Hi everyone and welcome to the Cardiac Rehab podcast. Today I'm joined by Sonya Lockett, who is our Cardiac Rehab Senior Physiotherapist and Service Lead, and we're going to be discussing recovery after open heart surgery. So this surgery is performed through a stenotomy and is often used for coronary artery bypass grafts, valve repairs and replacements, and operations on the aorta, which is the main blood vessel leaving the heart. So following this surgery, patients can sometimes be surprised by the number of attachments that they have in immediately after the operation. Could you talk us through some of the main ones?
So some are there for monitoring and others as treatment. There's a tube that sits in your windpipe and that's needed for ventilation to inflate your lungs whilst you're under the anaesthetic and until you wake sufficiently to breathe for yourself. Now when that tube is taken out, it can leave you with a sore throat or a hoarse voice for a little while afterwards. You also have a few drains in the chest area. They drain fluid, blood or air that can be created from the operation itself, and they're removed once they're no longer draining and usually within the first few days. There are some thin wires visible in the lower chest. On the inside they're stitched to the heart, and on the outside they're attached to a temporary pacing box. This can quickly be switched on to pace and regulate your heart if there are any problems with your heart rate or rhythm, and that can sometimes happen in the first few days after the operation due to irritation and inflammation. A catheter allows the measurement of your urine, so the colour and the quantity of your wee, and that's to make sure your body's fluid requirements are being met and your kidneys are working well. Again, that would be removed once you were more mobile and that recording was no longer needed.
So as patients recover and those lines and drains can be removed, can you talk us through the typical healing timescales after open heart surgery?
Everyone is slightly different in terms of healing times and the operations that they will have had, so it is important to remember to listen to your own body. But as a general rule, it takes the chest bone or sternum that is cut through during the operation about 6 weeks to knit together with soft bone, and 12 weeks before that bone then hardens off and you can do most activities again without any restrictions. Soft tissue and skin usually heals a few weeks ahead of that, but the small nerves that are cut through are much more slow growing, so you can experience things like numbness, pins and needles, or hypersensitivity where those new nerve endings overreact to everyday things like contact with clothing or touch. Over time this does settle as those reactions dampen down and those nerves become desensitized to those things again.
And can anything affect those healing times?
Unfortunately, there are several things that can slow that process down. So if you're older, your cells can't always regenerate at the same speed. If you're diabetic, that can affect your healing. And also if you're very overweight, that puts additional pressure and tension on those tissues that are repairing. Also, if this is a second procedure for you, so if you've had what we call a redo stenotomy, the surgeon there will have made another incision through existing scar tissue, and that tissue will have lost some of its elasticity, which will also affect how quickly it can knit together and repair. So if you do have conditions and things that can slow this process down, it is advisable to add on another few weeks to those healing timeframes and activity timescales that you're given with your discharge information from hospital.
And what about speeding up the healing process?
Eating a healthy balanced diet will give your body all the fuel, the nutrients, those building blocks that it needs to create new cells. And following all the discharge guidance that you're given in hospital, so avoiding lifting heavy weights in the early weeks. That can put too much tension on your chest wound or shearing forces through the chest bone. And also practicing good wound care where you're keeping that area clean and dry will certainly help to make the healing process as short as it can be.
You mentioned there about practicing good wound care. Can you tell us what that would involve for patients?
Yes, so certainly keeping the areas dry and clean where possible. You can wet those areas for washing and showering, but then please only dab those areas dry with a towel. Try not to rub at the wound. Avoid using any perfumed products in and around the wound, as that can really irritate the new skin as well. And try to wear loose fitting clothing over the wound to avoid any friction. As the cuts heal, they do scab over, and that can make the area become quite itchy, but please don't pick at those scabs or try to force that process along, as that can lead to another potential source for infection. If you were a smoker, ideally you will have already stopped before the operation, but if not, it is really important to stop afterwards. Smoking not only slows healing, but it also increases the risk of things like developing an infection.
And how would patients check for signs of a wound infection? What should they look out for, and what should they do if they notice any of these things?
So this can include things like the area becoming very red and swollen, so puffy to touch. It can be hot to touch as well, and you may notice a new discharge that starts weeping from the wound. It can have a different and unpleasant smell to it. Infection also has a systemic response, so whole body response, and that can mean you get more general body signs, things like a high temperature, shivers, and overall body aches and pains. If you do suspect that you have a wound infection, it is important to flag that up with your own doctor as soon as possible. Please don't wait for your outpatient review with the surgeon if you notice those things.
You talked earlier about the need for good nutrition during recovery, but patients can sometimes experience a poor appetite in the first few weeks after surgery. Why does this happen?
It is very common to have a poor appetite in the days and weeks after surgery. The medication that you have in the early stages, that can sometimes make food taste different, and that can affect your motivation then to eat. You may have felt sickly in hospital, which may have left you eating only small amounts, and that can sometimes then reset your hunger thermostat. Heart surgery can sometimes disrupt the balance within your gut, and the new medications can sometimes give you diarrhea, and the painkillers can lead to constipation. And those effects can then be worsened when you're not as mobile. These things do resolve themselves as some of those early medications leave your system and your body adjusts to the new ones that you will continue to take. And also once you're back in your own environment and back in a pattern with your eating habits.
So can you suggest anything that a patient could try to improve their appetite and maintain their nutrition in those early weeks after surgery?
As we've mentioned, your body does need the calories and the fuel to heal in the weeks after an operation, so it is important that you're eating well. But large meals can often be over-facing and are probably going to put you off, so it can help to eat smaller portions but little and often throughout the day, so your calorie intake is maintained but it is broken up. Choosing softer options will take less effort to chew and eat, and that can work well. So things like porridge, soups, eggs, chicken, fish, soft vegetables and fruits or fruit juices, they're all really good sources and together are generally better for you. Foods that are high in fibre will help aid your digestion, whilst those foods that are high in the bad fats and full of sugar, as well as not being that good for you, can also act to upset your stomach further. So try to avoid these.
Is there anything that patients should look out for if those things don't improve? And if so, what should they do?
Yes, it is important not to strain or put added tension in your chest area in the first weeks after your operation. So if constipation is an issue that isn't helped with your diet or as you become more mobile, then that is something that you need to flag up with either your doctor or your local pharmacist. You're often put on laxatives or stool softeners after the operation, and that's to make it easier for you to go to the toilet without straining. So that's something that can be restarted if it's needed. Constipation and bloating can also make your tummy feel quite tight and put pressure in your abdomen, and that's something that can make your breathing feel that bit more uncomfortable as well.
Patients can sometimes experience shortness of breath that can last a few weeks after their surgery. Can you talk us through why this happens?
This is something that we do hear a lot from patients. So whilst the operation itself happens on the heart, your heart and lungs sit in the same chest cavity, so it also has a big effect on them. So firstly, during the operation, you are on mechanical ventilation, and that forces the air into the lungs in an unnatural way. The anaesthetic gas can also be very drying to the lungs. So there's a lot of inflammation that can happen inside the lungs immediately after surgery. As the chest bone or sternum is cut through during the operation, then pain and discomfort in that area can cause you only to take shallow breaths, and that leads you to only use the upper parts of your lungs, causing the lower parts to close. As that sternum knits together, your ribcage movement can also feel a little bit more restrictive, and good ribcage mobility is needed for full lung expansion. So all this feeds into shallow breathing, using smaller lung volumes, and that in turn then leads to this ongoing shortness of breath.
And what can patients do to improve their shortness of breath caused by those things?
Firstly, it's important to take your painkillers regularly and as they've been prescribed and for as long as you need them, and that's so that you can breathe comfortably and cough strongly if you need to clear any mucus from your airways. You will have usually been shown some deep breathing exercises by a physiotherapist in hospital, so taking a full deep breath of air in, holding your breath for a few seconds and then breathing slowly out, doing 4 or 5 in a row, no more than hourly. And this is something that you can still continue with afterwards if it's helpful. Changing position can also help, so sitting or lying for a long time, that can restrict your ribcage movement and compress your lung tissue slightly. So simply standing, where gravity can help give that natural pull to the lung tissue, can help towards opening out those lower airways. But best of all is walking. That will naturally help you to breathe deeper and faster, which helps air get to the very bottom of your lungs to open out those lower parts that may not have been fully working after your operation.
When patients leave hospital, they can often feel apprehensive about increasing their walking. Can you give some guidance on how much to do and why it's important to do this after this type of surgery?
So try to walk daily and to a point where you can feel comfortably breathless. Now that may be just room to room or out in your driving garden to start with, but aim to walk for 10 minutes by the end of the first week of leaving hospital and 30 minutes by the end of the 3rd week. Now if that isn't realistic for you, it may be that you have other health conditions which restrict prolonged walking, then you can break this up into 2 15-minute walks, one in the morning and one in the afternoon, or even 3 10-minute walks throughout the day. But it is important when you walk to take yourself gently into that breathlessness, not to the point of it feeling very uncomfortable, but enough to start recruiting those airways again and give a gentle stretch to your rib cage and all those muscles in between that are used for breathing.
And what about other common activities? When can patients start driving or returning to work, for example, after their heart operation?
A lot of patients tend to wait for their surgeon's review before they consider things like driving or returning to work, but at the moment the DVLA does request that you wait at least 4 weeks after your surgery and that you're cleared by a doctor before you drive a private car or motorbike and that you notify your motor insurance. Please remember that's a minimum though, so only return to driving once you feel alert and that you can react and concentrate enough to be in control of a vehicle. For returning to work, it depends on the job that you do and the flexibility in working hours and tasks. So most people tend to be signed off for 12 weeks after their heart surgery. Now you can return to desk-based work earlier if you are feeling well enough, around 6 to 8 weeks, whereas physical work will take longer, so it is advised that you wait the minimum 12 weeks there. That gives time for your chest bone to fully heal and for you to have seen your surgeon to assess things like sternum stability. It's a good idea to discuss with your work the option of a phased return, so starting on shorter hours or with lighter duties and build up to previous levels gradually, so that sets out some really clear expectations and avoids any frustrations or disappointments along the way. And please remember your cardiac rehab appointment. That usually takes place about 1 month from discharge, and there you can be given further guidance on when and how to return to various different activities.
Perfect, that's been really informative, and you've covered a lot of information about the things to expect in the days and weeks following open heart surgery. If anybody has any further questions or would like any more information on anything that's been discussed in today's podcast, then please speak to your cardiac rehab specialist or your surgeon, your GP or your nurse. Thank you for listening.